Have you ever had a denture patient that's come back for 97 adjustments and is still not happy? Denture patients can be one of the most rewarding patients, but they can also be the most difficult. So most of the success of a denture patient comes in the communication before you start and the diagnosis before you start. Don't try and do things that are impossible. I have a patient actually just today who come in and said, I can't chew on my denture. And I said, well, if you look at our original consultation, I said you'd never be able to chew on your denture until you had back lower teeth. And so until you get them, you won't be able to chew. So that was a communication that we made right at the start, setting expectations. First thing with your denture patient is you need to work out how long it takes to make a denture and put it in their mouth. And then you need to double that, because that's how long it really takes to make a denture. On average, I plan on as many weeks adjusting the denture after it goes in as it took me to make the denture in the first place. So if it takes me 6 weeks to make a denture, I expect to do 6 weeks of adjustments after the denture is made. And this is normal. So don't think that a patient who needs 6 weeks of adjustments after you put a denture in is wrong or strange or useless or annoying. That's actually normal. I mean, if they're still coming back after a year and 57 adjustments, then you need to say, I can't do anything for you, but most patients need adjustments and they need several weeks of adjustments. So first, accept that's normal. If you don't charge enough to cover all of those adjustments, either tell the patient how much it costs per adjustment before you start, or increase your fee, one or the other. But if your fee is only enough to get the denture in their mouth and doesn't cover any adjustments, then you are going to be sad, and so is the patient. Secondly, look at the patient and see whether it's actually possible to fix their troubles. If they come in and go, I want suction on my denture, and you look at their upper jaw and there's just no bone, there's no gingiva, all the gingiva is floppy, the bone has significantly resorbed, they've got lower front teeth but no lower back teeth, then just have an honest conversation with the patient before you start. It's better to do no dentistry than to do weeks of dentistry and then give the money back afterwards. That's just like a short-term loan that the patient gave you. If you can't actually do the treatment, then don't do it. It's okay to say no. If a patient needs implants to have any chance of success, then tell them that. And if they say, well, just try the denture, you go, okay, I will make the denture and I will do this number of adjustments. But if it's not comfortable at that point, it's a problem with your jaw and you will not get your money back. Are you okay to proceed? And if they are, then get them to sign. If they're not, then don't go ahead. Never, ever be more eager to do the dentistry than the patient is. Lastly, watch out for the patient who has a bag full of dentures. Anyone who comes in with a bag full of dentures is going to be a really difficult patient. You cannot ever make these patients happy, so just say no. So part of the key with denture patients is 1, spend a lot of time with them after the dentures are inserted. 2, charge enough that you can spend that time. 3, don't take on patients who have a bag of dentures. And 4, don't do dentures that are impossible, like patients with no jaws who want suction or who want to eat an apple.